Patients declining treatment happens to everyone.
We want to equip our listeners with tools so the decision feels collaborative, because when patients feel informed instead of pressured, they don't feel like they're being sold to. They feel cared for.
The real goal is trust plus clarity plus emotional understanding. So when those three align, decisions become way easier and more confident.
Communication skills can be learned. You can refine it, rehearse it, and improve it, just like any clinical procedure.
Patients don't need the textbook terminology to make a decision. They need to know what's happening, why does it matter, and what would happen if they ignored it.
So the real question is, how do you help patients say yes to the treatment they need without feeling salesy? All right, welcome back to Project Confidence, the podcast where we talk about the real stuff in dentistry: careers, confidence, leadership, and all the things nobody taught us in dental school, like how to have difficult conversations, how to set boundaries, how to negotiate contracts, and apparently how to talk about money without breaking into a cold sweat.
Seriously, we learned how to prep rounds, read radiographs, memorize nerve pathways, but nobody handed us a script for, so this is going to cost $1,800. That lecture was mysteriously missing from the curriculum.
Right? There was no communication 101, what to do when a patient says, "I'll think about it." We didn't know that we needed that class when we were students. We were just so busy trying to pass our boards and graduate on time.
Same. And today we are talking about something every dentist experiences, but nobody feels fully comfortable admitting they want to get better at: case acceptance.
Yes, that phrase alone makes people tense up a little bit.
Because it sounds like a sales seminar. It sounds like we're about to teach you how to close deals, and that is not what this is.
Exactly. This is not, how to convince people to buy dentistry. This is how to communicate so patients understand what's happening in their own mouths.
Huge difference. One feels icky, the other feels like being a responsible healthcare provider.
So the real question is, how do you help patients say yes to the treatment they need without feeling salesy or pushy or awkward? Because let's be honest, most of us did not go to dental school to become salespeople.
No one fills out their dental school application like, "My dream is to spend half my time turning patient rejections around."
It's crazy that after all those years of biology and chemistry and anatomy, it all just boils down to figuring out a nice way to say, how can I convince you to pay for this thing that you need?
But jokes aside, this is something that affects literally every dentist, whether you're brand new, 10 years out, or you own multiple practices. Patients declining treatment happens to everyone.
And the goal isn't 100% yes. That's unrealistic and honestly not ethical. The goal is making sure that a no isn't happening because we failed to explain something clearly. Because when patients truly understand their options, their risks, and their outcomes, then whatever decision they make is an informed one. And that's the win.
And if you're a dental student listening and thinking, wait, we have to do this too? Yes. But we promise it's a learnable skill, not a personality trait.
Exactly. You don't have to become someone else. You just have to become clearer, calmer, and a little more intentional with your words.
I want to reframe this right away. Case acceptance is not about convincing someone to buy something. It's not retail. It's not upselling. It's not, "Would you like fries with that composite?" It's about communication, trust, and helping people make informed decisions about their health.
Yes, because the second it feels transactional, we all get uncomfortable. The patient feels it, the dentist feels it, the assistant feels it. The whole room gets weird.
Exactly. And if you're uncomfortable with case acceptance, it's usually not because you're bad at dentistry. It's because nobody taught you how to talk about value, cost, and timing in a way that feels natural. There was no practical exam where a standardized patient says, "That's expensive," and you have to respond without panicking. We associate talking about money with being pushy, when really it's just being transparent. Patients actually appreciate clarity. They just don't appreciate pressure.
And transparency can build trust, while pressure is going to erode it. Two very different outcomes from the same conversation, all dependent on tone and intention.
So this episode is not how to pressure patients. We are not teaching scripts to corner people or overcome objections like it's a sales boot camp. This is how to stop losing cases because of totally avoidable communication mistakes. The kind where you walk away thinking, they need that treatment and I just didn't explain it very well.
Or when you realize later you used 3 highly technical terms, showed them an x-ray for like 2 seconds, and then immediately started talking about insurance percentages.
And they're sitting there like, "I just came in here for a cleaning."
We want to equip our listeners with tools so the decision feels collaborative, because when patients feel informed instead of pressured, they don't feel like they're being sold to. They feel cared for. And that's the goal. Not higher numbers for the sake of numbers, but better conversations that lead to healthier outcomes. And if someone says yes because they understood you, then that's success. And if someone says no because still trusts you, then that's also success.
The only real loss is when they leave confused, unsure, or thinking dentistry is just people trying to sell them things. So today is about refining a skill set we were never formally taught and making it feel aligned with who we already are as clinicians. Okay, so now we're going to get into some of the most common myths about case acceptance and getting patients to go from no to yes. They don't sound wrong on the surface. In fact, they sound logical, professional, even reassuring, but they're incomplete truths, and incomplete truths are what quietly chip away at dentist confidence over time.
Yeah, you don't even realize they're shaping how you talk to patients until you start unpacking them. And once you do, you're like, oh, that's why that conversation felt off. So let's slow these down and really just pull them apart because once you understand the myth, then you stop personalizing those outcomes that were never personal to begin with.
So, myth number one is if patients trust you, they'll automatically say yes. This one feels comforting. It feels wholesome. It feels kind of like the moral high ground. We all want to believe that if we're kind and competent and ethical, trust will naturally lead to agreement. And again, trust is critical. It is the entry point. Without it, nothing else works. But trust alone is not the entire decision making engine.
That's right. A patient can absolutely trust you and still say no. Trust doesn't cancel out fear, it doesn't erase the financial stress, and it doesn't automatically translate complex dental terminology into plain language in their head. Think about it. You can trust your physician and still hesitate when they recommend surgery.
And sometimes patients trust you so much they don't want to admit they're confused. They don't want to disappoint you or seem uninformed, so they nod, they smile, they say okay. And then they go home and Google things for 3 hours and spiral into indecision. So when they decline later, it's not betrayal, it's often unaddressed uncertainty.
Or they just never emotionally processed it. Dentistry is logical to us, but it's emotional and financial to them.
Yeah, and emotions slow decisions down. People need mental space to digest risk, cost, time, and fear. Trust simply means they believe you're not harming them. It does not mean they fully integrated the information into their own priorities yet.
And sometimes trust gets you a not today instead of a no forever. So instead of assuming trust equals automatic agreement, think of trust as permission to have an honest dialogue.
The real goal is trust plus clarity plus emotional understanding. So when those three align, decisions become way easier and more confident.
And when they don't align, it doesn't mean that you failed. It just means one of the elements needed more time.
So myth number two is if they say no, they don't value their health.
This myth is subtle, but it's the one that can quietly harden a clinician if they're not careful. It creates this invisible wall where dentists start protecting themselves emotionally by assuming indifference on the patient's part. And the truth is, most patients are not indifferent, they're overwhelmed.
Correct. A no often means I'm trying to juggle 10 priorities, and this one feels big. We see one mouth. They're living an entire life outside that operatory. Kids, parents, mortgages, medical bills, work stress, time constraints, fear of procedures, past trauma, all of that walks into the room with them.
And sometimes dentistry just wasn't the top priority that day. So declining treatment doesn't mean that they don't care about their health. It might just mean that they care about stability and predictability or emotional safety just as much. Humans make layered decisions, not purely logical ones.
And sometimes no is just shorthand for not right now. And not right now is not a character flaw, it's timing. So when dentists interpret no as rejection or irresponsibility, it shifts their tone without them realizing it. You become less warm, less patient, less curious. And ironically, that makes future acceptances less likely because people feel judged faster than we think.
A healthier internal script to have would be they're processing, they're not rejecting. That mindset keeps empathy intact and keeps the door open for follow-up conversations. And then a thoughtful and well-timed follow-up is where many yeses actually happen.
Exactly. Decisions often mature over time. So a no today is often a yes when circumstances change, when clarity increases, or when fear decreases. Removing judgment keeps you emotionally steady and professionally grounded.
Okay, let's move on to myth number 3. The best clinicians automatically have high case acceptance.
This one hits hard for perfectionists. There's this quiet assumption that if your dentistry is excellent, acceptance should naturally follow. And when it doesn't, people internalize it as a professional failure. But clinical mastery and conversational mastery are two distinct skills.
Hand skills and communication skills are not the same muscle. You can prep a flawless crown and still struggle to explain why it's needed in everyday language. Technical precision doesn't automatically translate into patient comprehension. And the dental world sometimes unintentionally reinforces this myth by celebrating that clinical artistry without equally emphasizing communication.
Yep, communication is not fluff. It's not soft skills. It's part of treatment delivery. So if a patient doesn't understand the need, the consequences, or the value, your technical excellence never even gets the chance to serve them. It's like having incredible surgical ability, but never getting consent.
Right. Case acceptance isn't a referendum on your worth, intelligence, or dedication. It's just a snapshot of how information was delivered and then received in a specific moment. And the empowering part of this is communication skills can be learned. You can refine it, rehearse it, and improve it, just like any clinical procedure.
Right. And no one is born knowing how to navigate emotional decision making conversations about health and finances. It's a practice competency. When you reframe case acceptance as a skill instead of a personality trait, pressure drops and the growth becomes possible. And growth feels a lot better than self judgment.
Oh, 100%. Because once you realize it's not about being perfect, it's about being clear and empathetic and adaptable, the entire experience becomes less stressful and more human for both you and your patient.
Let's talk about dental jargon.
Oh, yeah. Dentists over-explain. We just do. It's in our nature. We're trained to be thorough and precise and scientifically accurate, which is great clinically, but sometimes not great conversationally. We walk into a room and we start saying things like, you have recurrent decay on the distal margin of number 19, and you need an occlusal composite. And the patient is just sitting there, smiling politely, but with absolutely no idea what we just said.
They're nodding like they understand, but internally they're like, is this a cavity or am I losing a tooth? We default to this jargon because that's the language we live in every day. It's comfortable for us. It's efficient for us, but it's not accessible for them. And accessibility is everything. If a patient has to mentally translate every other word you're saying, they're not really hearing you. They're trying to decode you.
And all of that decoding takes energy. Decision making already takes energy. So now they're spending their mental bandwidth just trying to figure out what the problem is instead of thinking about whether they want to solve it. And then we wonder why they hesitate.
People don't like making financial or medical decisions when they're unsure what they're agreeing to. And here's the important reframe. Patients don't say no because they're dumb. They say no because they're confused.
Nobody wants to admit they're confused in a healthcare setting. There's a lot of vulnerability there. A lot of patients won't say, I don't understand. They'll say, I'll think about it, because that feels safer. It protects their dignity. So what we interpret as hesitation is often just unspoken confusion. So when you simplify the language, you're not dumbing it down, you're opening it up.
Exactly. Saying a small filling on the chewing surface instead of occlusal composite doesn't reduce professionalism. It increases clarity. Patients don't need the textbook terminology to make a decision. They need to know what's happening. Why does it matter? And what would happen if they ignored it?
Because if a patient doesn't understand the problem, then they can't value the solution. And value isn't just about cost, it's about the perceived importance. Importance only exists if the issue is clear in their mind. And if the problem feels abstract or technical, then the solution will feel optional. And when the problem feels real and understandable, the solution feels logical.
Right. You don't have to dramatize anything. You just have to make it comprehensible. When patients truly understand what's happening in their own mouths, they don't feel sold to. They feel informed. And informed people make more confident decisions, which ultimately makes the whole experience better for everyone in the room.
Less tension, fewer awkward pauses, fewer I'll think about it moments. Just clearer conversations and decisions that will feel grounded instead of rushed.
Okay, Diana, I want to talk about something that comes up constantly when we're teaching case acceptance, because doctors will say, I explained it really well. I don't understand why the patient still said no.
Yeah, that line alone tells me exactly what's missing, because explanation isn't the same as understanding.
Exactly. And that's where visuals change everything. Photos, x-rays, intraoral cameras, mirrors. When patients can actually see what you're seeing, the conversation shifts. You're no longer telling them something is wrong. You're showing them their own mouth. And that distinction matters so much, because once they see it, it's not your diagnosis anymore. It becomes their decision.
Yes, ownership is the key concept here. When a patient sees a crack, decay, bone loss, a failing margin, whatever it is, they connect the dots themselves. You don't have to convince. You don't have to persuade. You're just guiding them. It removes that adversarial feeling some doctors are worried about. I hear this a lot. I don't want patients to think that I'm selling it to them, but showing isn't selling.
I always say patients don't say no to treatment. They say no to uncertainty. And visuals eliminate uncertainty.
Yeah, think about it. Most patients have no reference point for what normal looks like in dentistry. You can say there's cavity on this tooth, and that's abstract. But if you pull up a photo and say, this dark area here shouldn't be there, suddenly it's concrete.
And then you add the mirror into the mix. I love mirrors for this reason. It's subtle but powerful. You're literally handing them the ability to look for themselves. And even more importantly, you slow down. You're not rushing through a diagnosis. You're saying, let's look at this together, which builds trust because patients feel included, not talked at.
And I want to call out something else here. This works especially well for patients who have said no before, or patients who are just skeptical, or patients who've been burned by dentistry in the past, because those patients aren't resistant to treatment. They're resistant to being told what to do without that proof. Visuals are the proof. And when patients see it, they often say things like, oh, wow, I didn't realize it looked like that, or that explains why it's been bothering me so much.
And now the conversation isn't, do you want to do this? It becomes, okay, what are my options? Which is the best place to be. Because once a patient asks about options, they've already said yes internally. They're just deciding how.
I also think this takes pressure off the doctor emotionally. You're not carrying the burden of convincing someone, you're just presenting the facts. And that reduces the burnout, honestly. When you stop feeling rejected every time a patient declines treatment, then dentistry feels very different.
Totally, because case acceptance isn't about being more charismatic or saying the perfect words. It's about clarity and transparency. Show them what you see every day. Bring them into your world for a moment and trust that when patients truly understand, most of them want to take care of themselves.
Here's another important point. Let's normalize questions about money. Patients are often embarrassed to ask about cost. When you bring it up calmly, you reduce that sense of shame because money can be awkward, but it shouldn't block care. Patients are already thinking about it. They just might not be saying it out loud.
Exactly. That's why framing it as part of the conversation makes a huge difference. You're signaling it's okay to talk about this, and the phrasing matters. Something like, this is an important decision. We can absolutely talk about timing or payment options opens the door without judgment. You're normalizing the discussion instead of brushing it aside or pretending it's not relevant.
And when patients feel safe asking about money, then it builds trust. They're more likely to engage honestly and make decisions that they can commit to. And it also reduces that, I can't afford it, but I don't want to say no hesitation because you're giving them permission to talk openly, which makes case acceptance a lot smoother for both sides.
That's the difference between a patient saying yes because they understand value and a patient saying no out of fear or embarrassment.
All right, here's something I think a lot of new grads need to hear. If you sound unsure, your patients will be unsure. Patients can sense that hesitation instantly. Even a slight wavering in your tone or your body language can make them question your recommendation. So the key is to know your stuff and present it with certainty without being aggressive.
Remember, you're the expert in the room. They came to you for guidance. They want your direction, and when you own that role, you remove doubt. Patients are more likely to trust the treatment plan and say yes. It's also reassuring for the patient. They feel like they're in capable hands and not being sold something they don't understand.
It allows the patient to relax and process and then make the decision without anxiety clouding their judgment. Simple as that.
Let's talk about mistakes. Mistake number 1, talking too fast. Mistake number 2, overloading them with 5 treatment options at once. And mistake number 3, taking rejection personally.
Yes, yes, and more yes. And I always remind doctors, a no today isn't a permanent no. It's often not yet, I need time or I need more understanding. Sometimes patients just need the space to process. It's not a reflection of your skills or your recommendation.
Case acceptance is rarely about one conversation. It's a process. A patient might come back in a week, a month, or even longer, ready to move forward.
And another big one, delegating everything. Team involvement is great. It builds efficiency and trust. But the doctor's voice matters. The patient is paying for your expertise and experience. And the team can reinforce and educate, but the doctor is the one who sets the direction. Patients listen differently when it comes from the person who has the degree.
So talking too fast, overloading options, taking rejection personally, and letting the doctor's voice get lost, these are things we see all the time. But once you recognize them, they're easy to fix. A patient who might have felt pressured or confused suddenly feels supported, informed, and ready to say yes.
With awareness, you can turn them into opportunities for better communication and stronger case acceptance.
Ultimately, case acceptance isn't about increasing production. It's about decreasing untreated disease. When patients say yes to necessary treatment, their quality of life improves. That's the mission. You're not selling dentistry, you're guiding health decisions.
Exactly. When you frame it that way, everything changes. The conversation becomes about care, not dollars. And patients can feel that too. When the focus is on their well-being, they're more likely to trust your recommendations.
It also reminds doctors why we do this work in the first place. The goal is healthier patients, not just a fuller schedule. When patients move forward with treatment, pain is prevented, teeth are saved, and confidence is restored. That is the real impact. So the yes isn't a financial win. It's a health win for the patient and for the practice mission.
Correct. Keep your focus on improving quality of life and everything else will follow naturally. Case acceptance done right is about clarity, guidance, and patient-centered care, not sales. And that's what makes it sustainable and meaningful for both the patient and the dentist. If you take one thing away from this episode, let it be this. People don't say yes because you pushed them. They say yes because they understood you and trusted you.
Communication is a clinical skill. You can learn it, you can refine it, and it doesn't have to change who you are.
Thanks for listening to Project Confidence. Remember to like, comment, subscribe, and follow us on Instagram at Project Confidence. Bye.
Bye.